Building Beyond Tomorrow. Our commitment to discoveries and innovations in women's and children's health.
At the University of Maryland School of Medicine, our very accomplished faculty place us at the very forefront of women and children's care. From the very first images of the developing fetal heart, through childbirth, infancy and beyond, our programs provide the very best care found anywhere.
The extraordinary new fetal medicine and pediatric programs at the University of Maryland School of Medicine have garnered statewide and national attention. Families receiving care for the most complex conditions have discovered the light of hope.
That I'll never forget, because that was the day that we met Dr. Harmon and we started our journey of hope.
We're learning more and more that fetal life determines many things far beyond the few weeks after the baby's born, that extend to the 6th, 7th, and 8th decades of people's lives. So more and more interest is focused on finding out things about fetal life that have applications to long-term health.
Because I had caught everything so early, she didn't need surgery at all. Dr. Harmon and his team gave us an awesome gift, and he helped us tremendously.
With cutting-edge imaging technology, University of Maryland School of Medicine's fetal care doctors can identify problems in the first trimester of pregnancy.
We start to look at the baby and see if the baby is normally developing, because the first 3 months is the time when all organs are actually formed.
Now we're able to take 3D pictures of the beating heart and expand it to a point where we can make accurate diagnosis of congenital heart disease, even when the heart itself is about ½ an inch across.
When Kelly and Rob Lyles were told that one of their twins might not survive, only the University of Maryland Center for Advanced Fetal Care had the sophisticated imaging available to give them hope for both their twins.
They're able to measure the blood flow in and out of the heart and the brain, the oxygen levels, which the other hospital wasn't able to do.
The detail in prior ultrasounds wasn't good enough for that.
As each week passed, we became more optimistic and hopeful.
The expertise of the School of Medicine faculty in using life-saving intrauterine fetoscopy techniques has made the Center for Advanced Fetal Care a statewide referral center, attracting patients from distant locations.
So we see patients that are at high risk for problems that we treat or try to treat, and we see patients with very specialized problems that are sent from far away for intrauterine treatment.
These very advanced techniques are able to correct life-threatening structural problems. For Jody de Villiers' son, opening the blockage which was preventing his bladder from draining meant survival.
He had this blockage. We wanted to know, was there a way around it? And Dr. Harmon gave us that way.
With a broad range of nationally acclaimed School of Medicine faculty doctors, the fetal and pediatric programs are in a unique position to offer multidisciplinary specialists who provide a continuum of care from pregnancy throughout childhood.
We are actually starting from the fetal diagnostic and maternal care point, and then getting all the other specialties involved early on. So we're sort of building the pyramid of care from the right perspective, the way that we see. And we have a very constructive collaboration with all the subspecialties, and everybody is very excited about that.
So now we have the continuity of neonatal care and pediatric follow-up, which means that our work is multiplied in its importance and sophistication.
For the smallest and sickest newborns, care is provided by the University of Maryland's Level 3 NICU, which coordinates closely with both the fetal medicine specialists as well as with the specialists the baby will require after delivery.
We actually get involved in terms of consulting with the family. We actually meet them over in the Center for Advanced Fetal Care during one of their appointment times. So the care is initiated early from our perspective, and we follow the patient really through the gestation until they deliver. And then once the baby delivers, we do provide the primary care here in our NICU with the help of some of our subspecialists.
Over the past 5 years, the University of Maryland School of Medicine has expanded its pediatric services to accommodate the urgent needs of children throughout the state, bringing in over 50 specialists to develop the highest caliber programs.
The Department of Pediatrics at the University of Maryland School of Medicine has built a department of specialists that truly is performing miracles on a daily basis. And the work that we're doing in terms of providing patient care, in terms of our research, in terms of our teaching, is drawing accolades and attention from Maryland and beyond.
The expertise of our faculty in pediatric surgery enables us to handle the most complicated cases, providing hope and life for children who need to beat the odds.
And they have performed miracles in the operating room, and working together, we have really saved many, many lives as a collaborative effort.
Daniel's Hope for Life has been a collaborative effort of fetal care doctors, the NICU, and now pediatric surgeons.
And we have a good number of children now who have particularly severe urinary tract abnormalities, children who would not otherwise have survived or not really been given any hope to the families. And these children are born and won't produce any urine right from birth. And we know that individually and as a team, we can provide care that is second to none anywhere.
You can't get that anywhere else. I mean, he has the experience, he has the know-how, and he has the practice. And to put all of those together, in my mind, is no short feat and kind of a step off of miraculous.
Another vital area, responding to the needs of Maryland's children, developed under the University of Maryland School of Medicine's Stellar Pediatric Initiative, is the Children's Heart Program.
So the Children's Heart Program is working in close collaboration with several other premier programs at the University of Maryland. So with the Center for Advanced Fetal Care, we help in the diagnosis of congenital heart disease in very young fetuses.
For infants born with heart defects, nationally acclaimed specialty pediatric surgeons are prepared to take over the newborn's care.
And I think that's what the strength is here, is that we can provide that continuum of care in one hospital. In a typical situation, that does not occur.
While Dr. Kaushal often performs heart surgeries on tiny newborns with congenital heart defects detected in utero, for older children, heart conditions may be totally unsuspected until a crisis situation arises.
It was close to the last 10 minutes in the game. Her team was losing by 1 point. She scored the tying goal, and she actually scored the winning goal right before she went into cardiac arrest.
And because of her congenital defect to her coronary circulation, her heart stopped working. So she was pretty much dead for a few moments. We made the diagnosis that one of her coronary arteries was actually arising from the wrong area of the aorta.
I could not have asked for a better hospital or group of doctors. He was one of the best surgeons that we could have had doing the surgery on her.
With today's focus on new medical horizons, the University of Maryland School of Medicine faculty are actively involved in research, constantly improving the pediatric care for tomorrow.
I think research is an integral part of working in an academic medical center. I mean, I could not imagine, working without trying to find out more details about the conditions that we're treating and about the factors that affect the outcome. And that's ultimately what research is.
We, within our division, do clinical research in addition to the basic science research. and we're always looking for opportunities to strengthen what we can do.
So we're developing this program to be the first in the United States and also the first in the world, and trying to understand if we can use stem cells for children with heart failure.
Key to the mission of the School of Medicine is educating the physicians of the future and training the researchers who will advance clinical practice.
And we believe we have an obligation not only to train the next generation of pediatricians, but to retain them for the state of Maryland. So the next generation of children will have great pediatricians.
I knew I was interested in maternal fetal medicine, and this is, you know, one of the best places to train for that. It's a very strong program in terms of high risk.
So the idea of the MD-PhD program is that you can identify relevant clinical problems with the medical degree that you have, and then with the PhD training have the tools to address those issues through research and hopefully help improve people's lives.
How have you been doing?
The fetal care doctors and pediatricians of the University of Maryland School of Medicine faculty have a commitment to compassionate care and to giving each child the best possible life.
We approach patients and families is that it's a privilege to do what we do.
We care, we heal, we teach, and we discover.
It brings great joy when you can go and talk to the family afterwards that everything went well, and we expect great things from their baby.
You feel like you saved life.
For the families and children who receive healing and love.
There are no words that can express that. We're very grateful. And I'm actually gonna cry.
I don't take it lightly that we have been blessed with such an amazing hospital and such an amazing group of doctors, nurses, and staff who care so deeply about these children, but also have the expertise to help save a life.
He gave us faith that we would have 2 babies in the end.
Thank you.
Thank you.